Well, as we've seen with the COVID restrictions, Philadelphia handles things a little bit differently when it comes to the pandemic compared to the rest of our area. Right now, the city is still in phase 1A, reserved mostly for healthcare workers and people in long-term care facilities. The health commissioner says we could get to phase 1B as early as January 25th, and now that group is going to be much larger than first thought.
Everyone's been waiting. Do I have to be 75 and up? Do I have to be an EMT?
The questions keep coming, and Dr. Ayla Stanford with the Black Doctors COVID-19 Consortium has been trying to answer all of them. She's on the advisory committee that helped frame Philly's phased plan that differs from the national guidelines. Now, Philly adults with high-risk medical conditions are in phase 1B instead of 1C.
Why is that? And that's because these medical conditions are common in low-income populations and minority populations. We have higher rates of them here in Philadelphia than elsewhere. It's a more important risk factor here. And this is one way for us to address the racial disparity in COVID mortality here in Philadelphia.
The alphabet soup of sorts is different across our area. New Jersey introduced phase 1B for police and firefighters last week. Delaware and Pennsylvania are still in 1A. Dr. Stanford is still busy running pop-up testing sites, now gearing up for vaccinations. And she knows a lot more people will fall into Philly's version of 1B.
We may decide to convert our coronavirus testing into coronavirus vaccination and use the same nurses and doctors to do the vaccines.
Vaccine registration sites have popped up, like this one for New Jersey and this one called Philly Fighting COVID, where you can join the waiting list and get notified when you're eligible. The Black Doctors Consortium started their own, reaching out to churches and people with a phone but no internet.
It's only been 24 hours since we went live, and there's nearly 1,000 people who have signed up.
And Philly's health commissioner said today he knows that the city will be getting about 19,000 doses of vaccine each week for the rest of this month. After that, he doesn't know how many doses Philadelphia will be getting, noting once again that the demand is much bigger than what is available in Philadelphia. Reporting live tonight, Matt DeLucia, NBC10 News.